Here's a secret. Hormone replacement therapy is not just to feel good. Long-term hormone replacement therapy is neuroprotective in postmenopausal women. Estradiol improves cognition and memory function if initiated immediately after ovarectomy in rats, but not if it was initiated after several weeks delay. It's neuroprotective in the hippocampus of mice. Remember that this is the area that's involved in learning and memory. Given this, discontinuing all hormone replacement therapy in postmenopausal women and older hypogonadal men could be trading the comparatively small risk of cancers for a much higher probability of degenerative neurologic disease. This is especially true in cases where there's an extensive family history of Alzheimer's. If I were an OB-GYN or a PCP, before I told either of these patients to not take hormones they could cause cancer, I would first ask the patient if there's a family history of not just cancer, but more importantly, dementias.